innovation is on the part of getting the more sophisticated products, introduced to the Indian markets and obviously manufactured in India, because that is, absolutely core at our heart of manufacturing everything that we do within the ecosystem and our factories.
Hello, Mr. Rakesh. It's an honor to have you on this platform. How do you as we know that you are from a surgical manufacturing background. So just introduce what is your brand name and what is your business exactly?
Hi, thank you very much for having me today. It's a family business. It's by the name Jajoo Surgicals Private Limited. We are into manufacturing of medical products. We make around 22 products and we supply it to all the hospitals across India.
As I understand that market of surgical products is a pretty unorganized, done in an unorganized way. So how do you manage this?
You are absolutely right. It's a very unorganized industry, So the market leaders, someone like us does not have a market share of more than 7 to 8% across India. The government have the regulations, but the regulations go for a toss in an unorganized industry. Manufacturers have their own reason to make something and supply something. We internally have a policy wherein we do not manufacture any products which we believe we cannot use it on ourselves in case we ever have to go to an hospital. So that's, I think, the ethical base we have kept it, which is much higher than the regulation part of it.
Okay. So what percentage of market practices the way you do it, you do your business, like producing ethical products?
For the consumable segment that we work into, not a very high percentage, is ethical, because it's a very small part of the entire pharma or the medical segment. So very unorganized in that sense. Not many people would be, following the standards that we do, because following standards has a cost to it. It requires a lot of manpower. It requires a lot of efforts to, then add up to the cost and then end up selling those products. So not many do it. But then, we are happy that we at least have a benchmark and we continue to follow that.
Okay. And how do we calculate how many beds or how many hospitals do you cater?
We generally cater to somewhere in the range of around 900 institutions across India. These compiled together would lead to somewhere around 80 to 90,000 beds that we generally end up treating patients and supplying our products to these patients.
Well, that's a big number.
Compared to the entire, the medical industry or the hospital beds available in India, I think what we are doing right now is just, very basics, and we have a long leeway to go.
Okay. And how do you see use of plastic in this industry, and is the industry going to transform with time from using plastic to some other element, some other material?
Right. Actually, our industry is moving more towards plastic because we use more of disposable. So we are moving from metals, cottons, towards more user-friendly products which can be disposed of easily, and the carbon footprint left out would be very less. So as an industry, we would end up using plastic a little more than the rest of the other industries.
Okay. But that is if you say about safety, the plastic is more safer and more convenient.
Yes, for a lot of products, specifically disposables, plastic come at a very lesser cost. It is easy to manufacture, it is easy to manage, it is easy to dispose of. Ultimately, it's a cost benefit to a patient, because in India, we need to reach a lot more patients with higher cost. Not many people would be able to get the kind of treatments that they actually need to have a better life. So reducing cost is obviously very, very important, in a 1.4 billion kind of population that we have, and reducing the cost is the primary factor that we all work on.
Okay.
And still maintaining those standards, that's most important, because you cannot compromise the medical standards by any means.
So in coming years, where do you see your business? Like you must have some ideal for you, like you have to set this benchmark in your journey of next 5 to 10 years.
Yeah, we do see a lot of developments coming. We ourselves are working on a lot of products. The advanced wound dressings is something that we are working on. As India grows, the healthcare system would evolve. So we would move from, giving out very basic bandages to a specific wound, and then treating every specific wound for a different product. So we would move towards more advanced wound dressings. The objective we see it that over the next 10 years, if we could get the wound healing time of a lot of patients down by 50%, I think that would be a job well done for the entire industry and for us in general.
That was really very new for me as well. That making a benchmark in a surgical industry, like thinking about it, it's something new. Even what I learned today from you. So
I think it's such a small part of the industry, but wounds is something that we all go through in the hospitals. It's very important that the faster the wound heals, there is a less probability of it getting contaminated and leading to further infections. So, more like the Western countries, we are skipping a generation of products, and India is moving right from the more traditional wound dressing products straight away to the advanced dressing of products. So, I think in India, we will skip one generation of these products and our people would be able to get much better healthcare at a more affordable cost.
okay, did you do some innovation in first aid kits as well?
No, we generally do not make the kit, but yes, a lot of components that
Components
to those kits is made by us. So what we try and do is we reach an optimum level of production and a material composition, which is very important. Because as a manufacturer, we use practically different raw materials to reach a common end product. And the skill with which we can combine those material to an optimum level, I think is where we really gain.
Okay.
And for us, the more innovation is on the part of getting the more sophisticated products, introduced to the Indian markets and obviously manufactured in India, because that is, absolutely core at our heart of manufacturing everything that we do within the ecosystem and our factories.
Okay. That was great. Good to have you, Mr. Jajoo.
Thank you very much. It was nice talking to you and I appreciate your time.
Thank you. I am signing off from the IMA podcast. I'm Yugal and I'm a member. Thank you.
Thank you, Yuvansh.